How physicians can manage new risks in a post-pandemic world on this week's Medical Economics Pulse.
Patients are very, very frightened. We know, we're seeing, our physicians are telling us, the patients are not coming in. Hundreds of patients are not coming to their appointments. So they're fearful. So getting communication out, making sure that the patients know that you're following CDC guidelines is going to be really, really important.
Medical practices across the country are reopening, but are they reopening safely? While physicians are eager to return to normal, it's vital that they have robust protocols and procedures ready to ensure patients and staff are safe. Today, I'm joined by Kerin Torpey Bashaw, Vice President for Patient Safety and Risk Management with the Doctors Company, to discuss how physicians can prepare to reopen and manage their risk in this new normal of healthcare after COVID-19. Kerin, thank you very much for joining us today.
Thanks for having me.
So the first question I wanted to ask is, a lot of physicians are considering reopening their practices or are in the process of reopening their practices. What criteria should they use to make their decisions?
Couple of things. They should, first of all, I think it's really important for them to have a framework to use. So when we think about opening a practice, I would recommend 4 things. The first thing is for them to look at their operations pre-COVID-19, because that's what the staff is used to, that's what the patients are used to. They also need to take a look at what's happening from a federal perspective, from a state perspective, local. It's all about local public health with the physicians. So they should be getting their direction from their local public health authority. That's where they're going to get the most information that's relevant to their practice. Then it's really important for them to be checking every single day those websites with that information. So having a framework and then getting the information together and then making sure that the staff are up to date and know what's going on. The staff and the patients, actually. Patients are very, very frightened. We know, we're seeing, our physicians are telling us, the patients are not coming in. Hundreds of patients are not coming to their appointments. So they're fearful. So getting communication out, making sure that the patients know that you're following CDC guidelines is going to be really, really important. And the criteria for opening really comes from that local public health authority.
Okay. In terms of safety protocols, cleanliness, sanitization, those kinds of things, what are some things that practices should consider? Could you kind of give a quick guide to what protocols and considerations practices should have when it comes to safety, sanitization, those kinds of things?
Sure. I'm going to preface it with a statement. Things are changing daily, and I don't think that can be overstated. I literally just pulled up to look up a question, and the CDC guideline had changed on May 29th. Very different than it was 3 or 4 weeks ago. So the most important thing is to have a go-to place where you can immediately look at what are the current standards. So there's a variety of different places, but when I talked about a framework, by framework, I mean, you want to look at administrative requirements. So patients coming in and out, your voicemail messages, how are you going to check patients in? Are you going to have a waiting room or not? You want to have standards related to and criteria related to your personnel. You have to be screening them. You have to educate them. They need to know precisely those protocols. So, and then your environment of care is probably the most important. And CDC, you're going to hear me say it 500 times. It's all about the CDC. You need to make sure that you are on that website daily, checking what the changes are. So you having a framework, looking at the changes and the protocols daily is going to be key to success.
Okay, great. Let's talk a little bit about PPE. It obviously was a huge story at the beginning of the pandemic. What are you hearing first from your physicians about whether they have enough PPE? And then can you talk a little bit about how to make sure a practice can keep their supply chains going while they'll have enough, especially going into the fall where there's a lot of prediction for a second wave?
Sure. PPE was very scarce at the beginning of the COVID-19 situation. It has improved. physicians need to make sure that they have the appropriate PPE for their particular practice. And it varies greatly by practice. There's no one-stop shopping. So a practice that is doing a pulmonary, where there's a lot of aerosolized solutions, they're going to need to have much more intensive PPE. So it's really broken down into standard PPE, and this can change. That's why you need to check the CDC guidelines. Standard surgical mask, gloves, absolutely for everybody. And then more can be added depending on what kind of procedure. So the volume, the types of patients you have, also you're going to want our hygiene stations for patients coming in. Many have difficulty getting masks on the outside. Everyone should have a mask when they walk in your office. Also, making sure that you have gel everywhere and that your cleaning procedures are set up. So the availability of PPE has improved. That could change. Right now we're on a downward slope. If we ramp up and it's an upward slope, we could get into trouble again. And so you have to prioritize. Another thing to consider, and I'm sure we'll talk about this in a minute, is telemedicine or telehealth. Everybody, and I think telehealth is where it's at right now. So you want to keep people at minimal risk. That means you want to keep them, if at all possible and appropriate, out of the physician office. And that can happen. It can happen easily. And there's a lot of guidance on CDC website for triaging, determining telehealth requirements.
Great. Let's talk about staff training. Obviously staffs have been out of the office for a few months. What types of training should be refreshed now? And are there any new types of training that physicians or office managers should conduct with clinical staff, billing staff, basically the whole gamut?
Sure. So there should be standard testing in general. So in general, you want to train staff regarding infection control principles. And the nice thing is you can go right to the CDC website and you can pull down the staff training. And you cannot educate staff enough. And the rules have all changed. So standard, before you even open your office, standard training again with infection control, use of PPE, donning and doffing. So if you are in a general medicine practice, you're probably used to wearing gloves. You're not used to wearing a mask. If you have a procedure or if they're doing wound care or something that has to be done in the office, you're going to want to gown up and you need to put that gown on correctly. If you're using N95 masks, most practices are not used to using N95 masks. There are OSHA requirements for testing and training staff. They need to know how to use it. So going through that infection control, that PPE testing, use of PPE, and then communication. Your staff are afraid. The staff have been through a lot, and they're actually afraid to come back. One of the stories that I just heard from one of my risk managers was an issue where a physician called small practices, with a solo practice or up to 5 physicians. They have local team members, they're locally training, and people are afraid. And so the issue of not having enough staff or staff leaving because they have daycare issues or they have to teach their children is starting to come up more and more and more. So having a rock solid training program that you're documenting standard things that you would want to train staff. And then I highly recommend a leadership evidence-based practice, which is the daily huddle. So at the beginning of your day, every day, you're going to check the CDC website. You're going to talk about the plan for the day. You're going to look at the patient lists and see who's there and what their issue is. You're going to, if you haven't called them before, which is another best practice, so they know what to expect and you can tell them what your process is, make sure that the team all knows what the plan for the day are for the patients. And then do check-ins during the day. The staff are going to be doing many more things than they have ever done. They're going to need to have cleaning protocols. I'm a huge fan, as are most patient safety leaders, of checklists. Tackling COVID-19 is about standardization. It's about standardizing your practices so you can improve them, stabilizing your practices, and then tweaking them every single day in a huddle in the beginning of the day is going to be key. Also, a debrief at the end of the day. What went well? what didn't go well. So I have a story if you want me to share it, which I think is really powerful and could, physicians love M&Ms, they love learning from one another. We had a practice call. The practice had done extensive work. They had their protocols in place. Everybody was trained. They had their PPE. They did all of their work offline with regard to educating the patients. The patients didn't come into the wait room. They didn't allow family or staff to come in. The patient was roomed. The provider went to give a deep injection that the provider needed to give, pulled the mask down to have a conversation with the patient, left it down part way while the injection was giving. And the family of this elderly person went ballistic because that is not the standard of care. So that's a huge change. So there's so many things that are changing. That one little slip is, it's a break in the standard of care, which can be very, very problematic, despite the extensive work that happened with this practice. One little slip, it can cause immense problems for a practice. So standardization, education, briefing, debrief at the end of the day, so you learn from your mistakes and you figure out what you can do differently tomorrow. That's going to be really important for keeping staff morale and for making sure that they're energized and they feel cared for and that they have a voice in what's happening in the practice.
A quick follow-up to that story. I think that was a very illustrative story for a lot of the doctors that are going to be watching this, because you can do everything perfect and just one bad habit or you're not used to it. So can you talk a little bit about when something like that happens? Inevitably there'll be a mistake, there'll be an error. What are some advice that you have in terms of how do you handle it after maybe you have a protocol in place and there's a breach of protocol, or something maybe turned out not as safe as you would have hoped based on the protocol? How do you handle it then?
Sure, there's many ways that you can handle it. It depends when it happens and when it's noticed. If there is a breach and the patient is upset, an apology, not admitting, but just saying, I'm sorry that you're so upset. And it depends on the nature of the error. Best thing to do is to call your risk management. If you're in a big practice with an affiliated academic medical center or large practice with a big group, you're going to have a risk manager that you can call that will talk you through what all the options are and that will coach you as to what to do. Our calls went up during our first quarter by over 36% in our insurance, in the insurance industry and at the doctor's company. So our calls and the duration of those calls went up. You have in your insurer and at the doctor's company, we have about 50 FTE. It's 50 people across the nation. And our job is to take calls 24/7, 365 to be there to support the physicians. So there was another example that I think is a great example. A physician called, patient came in, they tested the patient was positive, and so the whole staff was exposed. The physician called and said, oh my gosh, do we need to quarantine? Do I need to shut down my office? Our risk managers actually use the site. So it's thedoctors.com. It's free for use. It's there for physicians to help them so they can help us and care for us. It's very, very important that they have a resource. So our risk managers actually use the public website because it was built that way. We talked the physician through the practice. They went to the CDC guidelines, and those CDC guidelines actually had changed the day previous. So there's a protocol based on the PPE that you use. So if you had all your PPE in place, you do not need to shut down your practice. That wasn't the scenario months ago. So by going there, we could say to the physician, you need to continue what you're doing. You need to monitor your staff every morning, screen them. You don't need to shut down your practice and self-quarantine. And the physician was elated and said, thank you. So really the big takeaway from here is that every practice is going to have their own plan. Remember I said pre-COVID-19, new standards, post-COVID, policies and procedures and practices, daily briefings to make sure your team are all on the same page, debriefing, and then call your risk manager. Like I said, we would much rather have people call us 24/7 than to feel left on their own. And having a framework And like I said, for people that want to visit our website, we have a framework that's set up in a very organized way, and we have a very, very comprehensive checklist. It's 7 pages of single-space checklist, and you can take what you want, but really in this time, you need to actually be going through step by step, what do I need to do and what do I need to avoid doing? Like the practitioner that accidentally pulled down their mask. Because in liability, it's really about the standard of care. So you want to make sure that you're following the standard of care, whatever it is. As I've said numerous times, it's changing every single day. So having a routine, having a go-to resource. The one thing I like about our website is that when you go there, we do all the updating. So we pull together all of the federal resources, make sure the links are updated, and we put it into a framework. So, physicians think very high level, but they want to be able to dive down into the detail if they need it. They don't want to look through a 50-page manual. So, a checklist that you can skim and you can hit a link so you can get the information you want is really, really important to physicians.
Great. Let's talk a little bit about communication and messaging with patients. Obviously, if you're going to have a very detailed protocol, you want your patients to know what that is. What have you found are some of the best practices in terms of really communicating out a standardized message to patients that actually gets to the patients that need to get the message?
Sure. When you look at a checklist, there's a variety of different things that physicians can do. I'm a huge proponent of having a conversation with the patient, educating the patient. It can be via email in general. I know from my medical group, I received a detailed email about what I could expect, what I needed to do, what would happen when I walked in the door. So I felt comfortable, with what I needed to do. It's the same thing with my dentist, sent me the same thing. I'm getting periodic communications about, we've implemented the CDC guidelines. We've enhanced our cleaning protocols. We are using standardized checklists based on CDC guidelines. People want to know that you're doing the right thing. Not only that, but when patients are coming in, we have had a couple of stories about patients walking in, wanting to videotape the whole visit because they want to make sure that people are doing what they are doing. And so those when you have people come in with those types of scenarios, it's a good idea to call your risk manager so you can have a conversation and understand what the patients want. The CDC, once again, you should count how many times I've said that. The CDC actually has excellent signage. You don't need to pay for the education, the signage, the training. You just need to check every morning and update because it's going to change. And then pre-visit, whatever you can do, put a call out, let the patient know what to expect, do any kind of pre-visit paperwork that you can accomplish before they come into the practice setting. It is really, really important. And then making sure there's constant communication. As I shared earlier, we had a practice, I heard another story, literally they called in because they said, we have a problem. We have had hundreds and hundreds of patients cancel and not show up for appointments that were either scheduled or that are for follow-up. And there can be some liability in that. So the practice's standard was, hey, you know what? We're going to call if a patient misses an appointment in 3 months, and then we're going to send a letter and document that we asked the patient to come in. And you can do that via your web or via the portal for the patient, however you want to do it. But I can't overemphasize the need to document all of your attempts to communicate with your patients. And if you do communicate, you need to put that information in the chart. So it shows your due diligence for reaching out and communicating and making sure that the patients understand the implications. With that story, it's kind of interesting because what happened is the patients were canceling, and now we're getting into 3 months. So the front desk is having a very difficult time with generating all the administrative things that need to happen. So they called us to see what other people were doing for some problem solving methods. But we highly encourage them, whatever you were doing pre-COVID-19, and if that was your standard practice, you need to continue to do that. And then modify it for COVID-19. So just because there's an administrative burden doesn't mean you should stop sending letters because you don't have enough people to do it. You have to figure those things out and, and make sure that you're following your own standard and the standard, across the nation.
Excellent. I have no other questions. I just wanted to give you a chance to talk about anything else that you think is important for physicians to consider as they reopen their practice.
Yeah, I first of all, I've spent my whole life around physicians. My brother is a physician. I have lots of friends that are physicians. Most of my career has been working with physicians. Physicians go into medicine. They want to practice good medicine. No physician goes in with the intent to harm. And so I think I would be remiss if I didn't use this opportunity for those that aren't physicians. Right now, our physicians and nurses are heroes, and they are putting their lives on the line to help their patients because they care about their patients. So there is legislation out there, the Corona Provider Protection Act, which has been introduced. And I can't say it enough. I think we need to support providers. These are crisis times, and practices are doing the best they can. So malpractice is about not meeting the standard of care. The standard of care is changing daily. So in the chaos, I think we need to tease out protection. Now, neglect and purposeful error, things of that nature, which happen almost never and rarely. Those are a different matter. But when you're trying to do the best that you can in a complex and ever-changing environment, I think we owe it to our providers to take a stand and to provide them with some protection. I don't need to tell the physicians watching this video, going through a medical malpractice case is incredibly stressful. And providers, we hear about burnout all the time, and we know burnout is an issue because of all of the administrative things that physicians need to do. They're not able to do and to fulfill why they went into medicine in the first place, and that's to help people. So I think we have to help them. And, that's why, my company is devoted to helping the practice of medicine. And one-stop shopping, making the administrative burden easier for physicians is so important. So I guess I would just end with, I would encourage you to the physicians that are watching to go to thedoctors.com. You can check out our website. It is free because our mission is to advance, protect, and reward the practice of good medicine for the medical profession. So there are incredible frameworks, resources, links. You don't have to do all the heavy hits. And then call your risk managers. That's their job, to help you mitigate risk and to get you the resources you need. And we have frequent flyers and people who call all the time. And those questions help us develop resources for physicians. And so our website is filled with information and resources. So check it out. I think you'll be really happy you did.
Thank you so much for joining us today.
My pleasure. Thanks so much.